That's right. You're live on Drive Time here on Joy 99.7 FM. Yeah. And our Drive Time is proudly brought to you by MTN. Everywhere you go, Access Bank, more than banking, Avis Rent-A-Car, We Try Harder, Bell Beverages, Refreshing the Nation, and Danix, Itin Starwin PLC, Das PLC. So all MTN SIM cards in Ghana must be registered again with only the Ghana card by the 31st of July 2022. Now note that you can dial star 400 hash to check if your registration has successfully been done. All successful registrations would have BCAP yes. If this hasn't been done, dial star 404 hash and follow the prompts. Now, failure to register your MTN SIM will mean that you will not be able to make voice calls, use mobile money services, internet, and all other services linked to your SIM card. Note that the registration is free and you'll not be required to make any payments. Plus, we'll give you 1 gigabyte of data free of charge or 1 hour talk time valid for 7 days. If you're a salaried worker, I'm excited to tell you that you don't need to wait for payday to get paid. You can actually get paid today. Yeah. Get paid any day with Access Bank Payday Loan offering by simply dialing star 901 star 11 hash. With this unique offer, you can access up to 40% of your net monthly salary before payday to solve pressing needs and still have enough to enjoy on payday. Now, this offer is open to all salaried workers. So if you want to enjoy this and more, switch your salary account to Access Bank today and get paid any day. Remember, it's simple. Dial star 901 star 11 hash and get your loan in 60 seconds. No documentation required. With Access Bank, any day can be payday. Terms and conditions apply. For more information, you can actually call us on 0800 004400. Or you can visit our social media or website. Access Bank, more than banking. My co-host is here. Dr. Yawa Safas, the CEO of Medicas Hospital. Doctor. What
Hi,
up, Doc?
Kwame.
How's it going? Having a good time?
Yeah, absolutely.
Yeah.
I need to come in more often. So
You
that
need to.
we can co-host.
Yeah. Anyway,
Is
really
it
good to
good?
see you.
Good to
Now,
be here.
guys, Doc wanted to hide this from us, but no. Won't allow him. So we actually have the health and wellness series coming up, Doc. And when were you going to tell me about it? Really?
Well, Kwame, I was waiting for just this very moment to talk to you about
Okay.
the health and wellness series. This is a new initiative that your superstation Joy 99.7 is introducing.
Right.
And we're going to hopefully introduce this as a quarterly event. I don't think we talk about health enough, but
true.
health is absolutely a precious asset that we don't often appreciate until we don't have it. So we want to use this platform, get distinguished speakers to come in
Okay.
and share their knowledge and skill with the Ghanaian public, and then also those who listen online around the world. So it's going to be very, very exciting. We'll have different speakers speaking about different areas of health.
What areas are we looking at?
So for this maiden edition, we're looking at mental health,
Okay.
which is unfortunately one of the neglected areas. But Kwame, if I tell you 1 in 4 of us will have mental health issues at some stage in our lives, then you realize that it's important. So do mental health. Then we'd also talk about wellness, nutrition. I mean, if I ask people about their family, whether they know whether their family history is very important and will determine how they should eat, the kind of food choices they make. So we'll talk big about nutrition and family health history.
Good
Then
stuff.
there's also going to be a discussion about a very important organ in our body that we don't think about often. Most people know about the heart, the lungs, but how many people know about the thyroid gland, for example?
The thyroid.
The thyroid gland. It's a hidden organ. Most people wouldn't know where it is, but it's an absolutely essential organ, and we will have a chat about it.
Is it in your thigh?
Kwame, the biology class. It's
So say
in your-
thyroid. Now
Ah,
thyroid,
the
where
thigh.
will it be? Is it not in the thigh?
No, Kwame. So tune in, Kwame. You have to be there. You have to be there on the 1st of August.
It's on the 1st of August.
1st of August. It's not a Wednesday show. So those of us who are listening to us, it's the 1st of August. It's a Monday. The time is 7 p.m. GMT.
Yeah.
And it will be carried live on your super station, Joy 99.7.
Oh,
it's
man.
a 2-hour program.
Okay, this is going to be exciting. I totally can't wait. I think we need this.
Absolutely.
And for me, it's going to help improve people's health-seeking habits as well, and consciousness when it comes to health issues and their personal health.
Exactly.
Yeah.
Exactly.
So this is good. I'm excited about it. Well, last week you helped us answer some very frequently asked questions about hepatitis B. We talked about how the virus is transmitted. We talked about the chronic hepatitis B infection, the symptoms, and all of that. Now, today you promised to take us a little further into hepatitis C as well, right?
Absolutely. So last week we started a conversation about hepatitis, and Kwame, I need to mention that every year, the month of July is we celebrate World Hepatitis Day. Not quite sure. I think it's the 28th of July, but that is a month that we want to focus a lot of attention on hepatitis. And when we talk about hepatitis, I think most people would know about hepatitis B in particular. But Kwame, there are about 5 hepatitis viruses. Hepatitis A, and they have the names of the alphabet: A, B, C, D, and E. Well, these are the known viruses, but most people know about B. So we started with B, and then today we're going to talk about hepatitis C. So what is hepatitis C? I think that's the first question.
Yeah.
Well, hepatitis C is an inflammatory disease of the liver.
Hey.
When we say well, it's an infection of the liver. All right. In simple terms, caused by a virus. And one of the virus is also called hepatitis C virus.
Okay.
And the disease is called hepatitis C. When I tell people that medicine is very simple, they think I'm kidding.
Please, this is one of the rare cases. Sometimes you see some virus go to school virus, and then they form something.
We mix it. We give you a big, but it would be feeling. So it's caused by an infection of the liver cells caused by a virus known as the hepatitis C virus. The virus can cause both acute and chronic disease. So you can have acute hepatitis C viral infection, and then another diagnosis can be chronic hepatitis C virus infection. And the severity of the disease ranges from mild illness, or sometimes I should say even asymptomatic, to very mild illness, to serious lifelong, or what we call cirrhosis of the liver, chronic damage to the liver, lifelong liver disease, and even liver cancer.
Wow, I see.
So it can go from being a nothing illness to actually being a life-threatening illness, and that is the range of severity when we talk about hepatitis C.
Okay, I remember last week we talked about how hepatitis B you contract it through mother to child, and then oral sex and bodily fluids and using infected needles and all of that.
Right.
How is this hepatitis C virus transmitted?
Right. So hepatitis C is primarily a blood-borne virus. All right. It's a blood-borne virus, and most infections will occur through exposure to blood from unsafe injection practices. So unfortunately, some of these things would happen in some healthcare centers. The bulk of our healthcare centers are regulated strictly and also staffed with properly trained and licensed healthcare professionals. But unfortunately, every now and then we'd see the Medical and Dental Council and the Nursing and Midwifery Council identify some unregistered, unlicensed places where, unfortunately, some of these unsafe injection practices I talk about would happen. Kwame, those who abuse narcotic drugs, for example, are also another category of individuals who unfortunately will share needles. So I remember, I know that in some countries, for example, they have a safe needle program where they identify substance use or substance abuse individuals, those who abuse narcotic agents and are addicts, and actually give them clean needles.
Oh, okay.
Because it's an addiction, and they're sharing the needles because it's a form of a fraternity.
Yeah.
So when they meet, the needles go around because they don't have ready access to it. Some believe it is promoting the habit, but then if you think about it too, then you are stopping the spread of a highly infectious and potentially debilitating condition such as hepatitis C. So I'll make the point again. It is a blood-borne virus, and it is a lot of the infections occur through exposure from unsafe injection practices, unsafe blood transfusions. For example, again, I did mention last week that we have the National Blood Transfusion Service of Ghana, who make sure that most health facilities across the length and breadth of this country stock with safe blood that has been properly screened. And then also sometimes the infection is transmitted through unsafe sexual practices that lead to primarily the exposure of blood.
Okay. So in hepatitis C, it's safe to say it's not bodily fluids.
Yes,
but it's rather in
B,
blood.
It's more like blood. That is a key thing.
Okay.
But then yes, it can still be transmitted through sex, because sometimes during sex there's bruising. All right, there's blood. Some people quite enjoy kinky sex.
What is that?
You
Right,
see
it's
me
okay.
in chambers. I will explain.
Okay.
Your daughter will soon be listening. Kwame.
So, actually, somebody just shared this and said barbering.
Right.
Question? At the barber shops.
At the
safe.
barber. Exactly. So again, we're talking about blood.
Yeah.
So we won't just lump them together and say barbering salons or hair salons are unsafe.
Yeah.
No. It depends on the practices.
Yeah.
So if you paid attention, I was just mentioning practices. So unsafe injection practices, unsafe sexual practices, and so on and so forth. So it's
unsafe barber practices.
So if they are sharing needles, blades,
and
and other those who do the manicure, the pedicure, business, they're using sharp instruments. Accidentally, you can cut somebody and then leave a drop of blood. These are microscopic. We call them microorganisms because they are microscopic in size and therefore not visible to the naked eye.
Okay. If you have any questions, send us a WhatsApp on 055 1111997. Okay. So, what are the symptoms of this C?
Right. So that's one of the questions that we frequently get asked. Are the symptoms of the disease? Well, in the initial phases of the disease and in competent individuals, then Kwame, you may not have symptoms of the virus. You'll get the infection. Let's not forget that the infection has an incubation period of up to 6 months. So 2 weeks to 6 months. Infection means you have the virus is in your body. All right. Then from that period, you may be asymptomatic, and the virus may just be going through its incubation period. It's not ready to cause havoc yet. Then those who have the acute infection may come down with a fever. A fever, I must say, and the Ghanaians have their own definition of a fever. And when they'll tell you, oh, Dr. Menya fever, me just say yellow. No, a fever simply means an elevated body temperature.
Okay.
That is what a fever is. So most people may come and complain about a fever. They'll come and complain about fatigue, bodily aches, a decreased appetite, nausea, vomiting. Kwame, does this sound familiar? Malaria. Most people will have these symptoms and they think, oh, I have malaria, and therefore they're going to the community pharmacy or the drug store and going to get some because they think they have malaria. So fever, chills, nausea, vomiting, headaches, body aches may not necessarily be malaria. And that's why we all see on the television these days adverts for you to test for malaria before treating for malaria. So these are some of the symptoms. You can also have abdominal pain, a dark urine, joint pain, and then sometimes yellowing of the white of the eye, jaundice.
Hey, I did a dozen.
So as it progresses, so you can go being asymptomatic to having these very non-specific symptoms, as we call it, non-specific symptoms. It is not just hepatitis C that gives you this. Remember, hepatitis B almost gives you similar presentation, and as I've alluded to, malaria also gives you very similar symptoms. So these are some of the symptoms. When you get chronic hepatitis C virus infection, then the liver is really in trouble, and then you get a host of other different presentations, which I wouldn't get too much into it right now. But there you'll be very, very ill, and you present with some other symptoms.
But how long after the infection do you begin to exhibit these symptoms?
Right. So Kwame, I mentioned that it takes anywhere between 2 weeks to 6 months. But there are some individuals who are immunocompetent, meaning the immune system is really, really strong, and the infection comes in and they deal with it completely. Your immune system takes it out. So you never actually get to know that you even had the infection. Some people too would get it, and then they would have a mild fever, a low-grade fever, a bit of headache, body aches, and then they'll put it down to, today I was very stressed at work, let me get enough sleep. He'll pop paracetamol, and then the immune system clears it up. So the waiting period can be anywhere from 2 weeks to 6 months, and that is the incubation period.
But with all these symptoms that you mentioned, it must be difficult to diagnose, or is it easy?
Well, it is not so difficult if you're talking to the right person, because we've got our list of differentials. A trained doctor, physician should be able to navigate his or her way through your symptoms, and then there are relatively simple laboratory investigations. These come sometimes as kits at different levels of complexities, but they now come as kits. So you don't even need a standard laboratory electricity. You can perform some of these tests under a tree in my hometown, Boso, in the eastern region. You can perform it there under a tree. It's not that complex. Once you get the kit, you take a blood sample, and then you drop it on it, and it looks pretty much like the pregnancy kits that are widely available these days. So you can do that, and it gives you a good sense of being positive. If you're positive, then your doctor would ask for much more sophisticated tests to confirm the diagnosis, and also look at the state of function of the liver, which is the primary organ that is attacked by the virus.
Very important question here. Can it be treated? Can it be cured?
Right. Yes. Once.
Yes, no form. Yes, no form.
Oh yes. Oh yeah. I was thinking about the treatment and cure. Sometimes you have to choose your words carefully. People use them interchangeably, but in medicine, then you've got to be careful when you're talking about treatment and then when you're talking about cure. Cure means
yes,
total.
no, is it? Hey.
Okay. Right. So a new infection does not necessarily require treatment. Like I say, your body can deal with it if you are immunocompetent. So you may not. We'll just treat some of the symptoms that you have, give you some paracetamol to some vitamin C at you, and then your infection will be cleared completely. However, when the infection becomes chronic, meaning that 6 months down the line you still have the infection, then we'll deem this thing as chronic. Then treatment is necessary. And the goal that we set for hepatitis C treatment is to cure the disease. That is the goal of treatment. And the WHO has its own recommendations for therapy using antiviral agents for all adults, adolescents, and then children down to 3 years age with chronic hepatitis C infection. So there is antiviral therapy for treatment. So we need to catch it early. Most people will go through, they are not able to clear the infection in the initial stages. Then the infection becomes chronic, and the time they come in to us is when they've developed chronic hepatitis C infection, what we call cirrhosis of the liver, meaning the architecture of the liver, the substance of the liver itself has been destroyed. You've got about 60% of the liver architecture completely destroyed and taken over by non-functional tissue. and therefore you lose a lot of function of the liver. At that stage, Kwame, then it is very, very difficult to reverse it. And then we begin to talk about liver transplants and so on and so forth.
Okay.
So then it becomes very, very difficult at that stage.
If you have any questions, you can call us on 0302 216 541. That's 0302 216 541. Or send us a WhatsApp on 055 1111997. Are there vaccines, though? I know the Hepatitis B vaccines.
Right. So unfortunately, that's where we are at the moment in terms of prevention. We don't have a vaccine that is effective against hepatitis C, unlike hepatitis B. So there is no vaccine, unfortunately. And Kwame, I say unfortunately because sometimes when you hear the debate right now about, vaccine safety and all of that, I cringe because vaccines have been very, very helpful to mankind since we introduced them into this country. And unfortunately, when it comes to hepatitis C, there are no vaccines. So when it comes to prevention strategies, safe and appropriate use of injections in healthcare facilities. So please don't walk to any so-called healthcare center and then be treated. These days, there are a lot of places that are masquerading as healthcare institutions. Look for the HEFRA logo, certification in that institution. When you are entering our facility, it's right there at the entrance. We put it against the signpost and all of that. It has to be properly certified. Safe handling and disposal of sharp instruments and used needles. Testing of all blood for hepatitis C before they are used. So make sure you get your blood from the National Blood Transfusion Service and follow all the regulations by the National Blood Transfusion Service in terms of how to use the blood. And then we need to prevent exposure to blood during sex. So that is also very, very important. The kinky business, let's reduce it.
Should reduce the kinky. But they want it. I mean... Yo, Joseph says, good afternoon, Lexis. Please ask the doctor, will someone have intimacy with someone infected with hepatitis B virus without being infected because of their strong immune system?
It is absolutely possible. So in all of these things, we predicate it on the status of your immune system. So most people would get hepatitis B and hepatitis C infection at one stage in their lives. But Kwame, for the vast majority, especially when you get hepatitis B infection about the age of 10 or in adulthood, then it is easy for your immune system. About as much as 95% of adults who get hepatitis B infection do not go on to develop chronic infection. Your immune system just takes it out. So 9 out of 10. But if you take children below 5 years of age and infants, those below a year, then you have as high as 90% of them going on to develop chronic hepatitis B infection. When you are an infant or when you're a child under 5, your immune system is now developing. It doesn't have the intelligence to be able to deal with these complex viruses. So there's a tendency for it to linger. So if you can have contact with somebody who has hepatitis B infection, you might get the infection, but your immune system will deal with it. Again, if you are vaccinated against hepatitis B infection, then even if you have contact with somebody with hepatitis B infection, you may not. It is very likely you will not if you are appropriately vaccinated. And remember, the vaccine efficacy lasts anywhere between 20 years and lifelong.
Okay. Well, this is really good information. I'm glad you shared this. What would be the takeouts for you? Any final pointers that people should note?
Right. So when it comes to hepatitis B, I just want everybody to know that number one is an STI. It's part of the sexually transmitted infections. They are viral diseases. Primarily, it affects the liver. You can have an acute infection and you can have a chronic infection. The chronic infection is what we fear the most, because when your liver takes a hit, then it's a life and death situation. Hepatitis B, hepatitis C chronic infection can lead to the development of cancer of the liver, primary liver cancer. And therefore, we should all make sure we don't develop hepatitis B, hepatitis C chronic infections. There are vaccines that exists for hepatitis B infection. I would encourage everybody to test, and if you are negative, please take the vaccine. The vaccine has been used for many years now. It has been proven to be safe, and most people should get it. Unfortunately, for hepatitis C, there are no vaccines, so we will hammer a lot more on the prevention strategies. Do not share needles. Do not share sharp objects. If you go to the barbering salon, Kwame, I've had my own hair clipper since I was in Presec. 28 years, 30 years ago. I've had my own hair clipper. My children go to the barbering salon, they have their own hair clipper. They don't even share mine, as well. So you must have that. The manicure, the pedicure, and I know I speak to the ladies when I mention this. They do a lot of that. I know that some men also do it. Please have your own set of instruments. That's what I would advise. And when you go, let them use that on your behalf. So these are some of the tips to prevention.
Okay.
When it comes to pregnant mothers as well, Kwame, let me land on this. The pregnant women, hepatitis B, we have what we call the vertical transmission, meaning a pregnant woman can pass it on to the unborn child. Fortunately for us, we've got medication to prevent that, and then so we call it the prevention of mother to child transmission of hepatitis B virus.
Okay.
So pregnant women should also take note and make sure they visit the antenatal clinics and get that done.
Okay.
So Kwame, these are my closing words on hepatitis.
Thank you so much, Doc. Please leave your contact for us.
Right, so those who want to reach us is 0501 477 340. 0501 477 340.
Dr. Yao Safo is the CEO of Medicas Hospital. Thank you, Doc.